beautiful people, welcome back to the channel. If you're so for the first time, welcome. My name is Lona and I am a registered nurse, a registered midwife, as well as a professional makeup artist. Over here we create content on faith and health, on nursing as well as makeup. So if these are the kind of contents you're looking out for, please do not forget to like, share, as well as subscribe and join the family. Now in today's video, we're going to be doing another story time video, and for me, the essence of me doing story time videos are to educate us on certain things I see. These story time videos are things that I have witnessed firsthand, or I've probably heard from someone directly based on my line of work. So I am saying these stories so that we could learn from it together. Okay, now today's video I'm going to be talking about an experience I had a long time ago during my midwifery days. Actually, I remember one morning I was on duty, so I went to work in the morning duty, morning shift. I went to work and I was assigned to the labor unit of the hospital as that day, and so I went to work. On appearing at work that morning, there was a woman already in the ward, and I thought she was a patient from the previous night. That's what I thought, that was in labor. And on asking the night nurses that morning that what happened, who is she and all, just to get basic information, I was told that the woman, let's call her Mrs. Winifred, okay, the woman Mrs. Winifred was brought into the hospital as a result of bleeding per vagina. That is, she was bleeding from my vagina. That's why she was brought into the hospital. And in this case, because she was pregnant, she was brought to the labor ward, and certain questions were asked of her. And it was during the interrogation we realized that she was pregnant for the second time and did not register for antenatal in that hospital or that facility or any facility as a whole. So she wasn't going for antenatal. Her first time appearing in the hospital since pregnancy was that day, and based on her calculation and information she gave us, she was 5 months pregnant. That's the first time the hospital was encountering her, so every information we're getting from her was fresh. So she said she started feeling pain and started bleeding, and hence she was brought to the hospital. Normally, if you're coming for antenatal, there are certain investigations that are carried out on you, but in this case, because of the woman's financial challenges she was going through, she could not do those elaborate investigations and all. So what we did for her in the hospital was just to run HIV screening on her. She couldn't even pay for the actual HIV test, and also, if you're in a medical profession, you know how you always bring out money and just put two and two together to just help the patients. It's quite a normal thing in the hospital. And this woman, Mrs. Winifred, was run the HIV screening test, and she tested positive for HIV. Mind you, that was the only investigation that was carried out on her as a result of financial constraint that she had. Okay, she had a child already who was already 15-year-old girl. So this was her second pregnancy. Now, from the midwife's observation, she felt that this woman was having more than one baby. She was thinking twins or triplets, but we're not too sure. Remember, we don't have any information as regards this woman. So she was working with the mindset that this woman was carrying at least twins in her uterus. Before I came for work that morning, the woman had already pushed out the first baby. I wasn't around when the first baby was pushed out at 5 months, and so we're now left with 2 babies in utero. I'm saying 2 because eventually we found out that she had triplets. Now it took some time between her delivering the first baby and the second baby, and the first baby came out on its own. Okay, by the time she got to the hospital, I was told that about 10 minutes later she pushed out the first baby without any help, no drug giving or anything. But the second and the third baby was taking some time, hence medication had to be given to her to help push out the baby. As a result of this, induction was carried out. Now the reason why it took time between the delivery of the first baby and the second and third baby was because of no contraction. The uterus wasn't contracting, and contraction is needed for the baby to be born per vagina, that's through the vagina. So we had to do induction of the labor to, trigger contractions and facilitate delivery of the baby. That was done, and shortly after the baby was delivered. Now, ideally, under normal circumstances, all this ought to be done in the theater setting. But like I said, the woman didn't have money. And in short, according to her daughter, the reason why she did not even register for antenatal and all that was because she didn't have money. So that's why even the antenatal and all, she didn't do nothing at all, even taking a drug, just even one drug at all during the process of the period of 5 months pregnancy. She didn't do anything like that. So the second baby was born, and that was the first time in my life I saw a 5-month-old baby. And I remember looking at the baby that time. I think the second and third baby came out almost simultaneously, And I remember looking at the babies that time. 5-month-old baby. It's not something you want to see because, God of mercy, it was something else. But and you could tell looking at the babies. I was a student then, and I remember asking, why are the babies like this? And I was told that babies were already showing signs of malformation, congenital malformation, because they didn't even look like a normal 5-month-old baby would look like. After the delivery of the third baby, it was discovered that there were 2 boys and a girl. And I know that is something that people are praying for, even just one child. But in situation, life happened. That's what I just call it. And so after having the delivery of the third child, we're now waiting for the placenta to be born, which normally happens during normal labor and delivery process. You have the birth of the child followed by delivery of the placenta. But in this case, because the woman is 5 months pregnant, the placenta was still very much attached to the uterus, right? And so it could not come out by normal contraction. Now they have to do manual removal of the placenta. I've forgotten the term we call it in midwifery, but you had to remove it manually. Remember, all this I said would have been done in the hospital, in the theater setting, but we're working with what we had at this point in time, and so we had to remove the placenta manually. Now the midwife that was conducting this whole process tried to pull out the placenta. She tried as much as she could, but she could not. Now I am trying as much as I can to say this story so that it doesn't sound very difficult for people to listen to it, because the real experience, it was not funny at all. This woman was in pains, like she was in pains. This woman was in pains. Labor and delivery is painful. Labor is painful, and this woman was going through heightened pain because of everything that was happening as at that point in time. Imagine the placenta being tried to be torn out because she was 5 months pregnant, and she tried to pull out the placenta. It didn't work. Mind you, the whole unit was smelling as at that time, and we could tell that apart from HIV, it's also possible that she had other infections, but we didn't know what the infections were. Since the midwife couldn't pull out the placenta, we had to call the unit head or so, but it was a male as at that time, and he came out to help us out. This man put on an elbow length glove. I think that was the first time I was not seeing an elbow length glove, if I'm not mistaken. Pulling out the elbow length glove to help bring out the placenta of this woman, and I saw this man put from his finger till very close to his elbow. Do you know the length inside this woman to pull out the placenta? I remember very well that most of my colleagues that were on duty with me started vomiting, and no, a lot of persons started having a lot of reactions to the whole drama that was going on, the whole experience that was going on, and a lot of people could not withstand it. But I stood there till the end. So a lot of persons left because it was really, really traumatic. So a lot of persons left the unit. A lot of persons were already vomiting at that time. And the man tried as much as he could. In short, in the process of trying to pull out, the blood of the woman splashed all over him. And remember, it's only HIV we know that she has. We don't know of any other condition that she has. And the man was quite pissed, but then medicine is not for the faint of heart. Your priority, sometimes it changes from yourself to you want to just save that life. The woman was in pain, and the woman she couldn't even talk. When the blood was splashed on the doctor, all she was just saying was she's sorry. But she was so weak. She was so, honestly. And after the whole thing, that day ended. The next day I came back. I wasn't in that unit again, but I came back to check up on the woman. She was still alive. Though at the end of the whole procedure, she couldn't even walk. So they had to wheel her out of the labor unit. But the next day I checked up on her. She was alive. So for me, the things I drew out from this whole experience was, please, I know that things are expensive. I know that things are difficult. I know that we're in trying times, but as a woman, your life is very important. Your life is very important. Please try. Please try. Anything could have gone wrong during this case. She could have lost her life. She could have lost her life. So it was just of God's grace and mercy that she was alive. Please try. You do not take antenatal for granted. I've talked about antenatal in previous videos. Don't take antenatal for granted. This is one of the several stories we see. I know that if a lot of persons in the health field come in the comment section and tell you what they've seen, what they've experienced, this could even be like nothing compared to a lot of other persons' experiences. But antenatal, when you're pregnant, is non-negotiable with you. And I know that I'm talking based off the fact that I'm a Nigerian. I know that there are places where these things has been subsidized to a level that people could be able to afford. Another thing, apart from prioritizing antenatal, is if you are not ready for a pregnancy, if you know that now, if I should get pregnant now, I'm not ready for it, don't get pregnant. It is cheaper to avoid pregnancy than it is to get pregnant and start managing and start. Even if you want to take out the pregnancy, it's cheaper you just avoid it. To avoid pregnancy, it's cheaper than you getting pregnant, looking for a way to terminate it, or looking for a way to manage it. Okay, you give birth to the child, you care for that child. It's not cheap. It's not cheap at all. So it's even cheaper to avoid it. Family planning is there. Please do family planning. I don't know if there's any other thing you can draw from this experience. Please let me know in the comment section below. Please do not forget to watch my other videos on maternal and child health. I know I may be sounding a bit down just because remembering that experience, it was as well. But don't forget to watch my previous videos on maternal and child health. Until I see you next time, God bless you and bye, lovelies.